What's up, guys? My name is Adrian, and um, I'm not a content creator, so you probably won't see a whole lot else on my page. But um, I am a 38-year-old woman. I am type 1 diabetic, and I am having a myomectomy in about a month. And I have been scouring YouTube looking for as much content as I can, wanting to know other women's recovery stories and all this stuff. And so I thought I would add my piece to it, especially with someone who is, has more health complications than other women. So yeah, and I have some notes here because I need them. So currently my health status right now is not as good as it has been in years past, for sure. I'm type 1 diabetic, which I've been for um, 30 years at this point, 31 years, forget which one, but over 30 years. And I also have had two shoulder surgeries. I had frozen shoulder on both sides. If you don't know what that is, I basically was not I had a lot of scar tissue built up in here, and so I wasn't able to move my body, my shoulders as much. So, um, so I had that. I've had a couple of surgeries on my hand as well for some joint issues. Um, but just to kind of give like a little brief history of my experience with surgery, I've had surgeries before, so I'm not so much afraid of having another surgery because I've had them before. But anyway, so as of right now, I've gained quite a bit of weight. I'm 5'2". I'm used to being about 150, between 150 and 170. But at this current point, I am about 200 pounds, and that's way more than I'm comfortable being, but also it has something to do with the fibroids. So um, I won't blame all of it on the fibroids, but the fibroids are impacting a lot of my ability to lose weight. So um, I'll show you what my belly kind of looks like because at present, the last I was told maybe 2 months ago, actually 3 months ago, um, the fibroids were large enough that I was like 14 and I was kind of showing as 14 and a half weeks pregnant. That's about how big the largest one is. And there are numerous fibroids. So that's kind of where I'm standing right now. Um, my largest fibroid is 10 centimeters. And then there's a 6 centimeter, a 4 centimeter, but when I looked at um, the report after getting some imaging done, the doctor who interpreted the results said that I had, quote, too many to count, or they were too numerous to count. So seeing that was really shocking and certainly devastating. Like I said, I'm 38 years old. I'm type 1 diabetic, but also I'm married, and my husband and I don't have any children, so we would like to have kids, and I'll kind of talk about that in a second. But um, I found out about the fibroid. So currently it's July 4th, 2024, and I found out about the fibroids. Um, I'll say like 4 years ago, maybe. I was more or less asymptomatic, to be honest. I went to my regular GYN appointment. My provider was doing the physical exam, and she said, "Oh, I think you have fibroids." Wait, no, those are definitely fibroids. And so she sent me for imaging, I believe, or yeah. I went and got at some point in the recent past, I had some imaging done. I think like several times. Like I had a vaginal ultrasound, and so that's where they stick the thing, up your into your canal, and they basically use that the end of it to look around inside of your uterus to determine if you have any, where they are, and whatever. So um, That's when I first learned that I had them. And I thought that I was asymptomatic until maybe November. I had an emergency room visit that led me to believe that I wasn't asymptomatic this whole time. I actually was displaying symptoms, but nobody had ever asked me about all of the symptoms before. So, um, the most typical, the most common symptom that women have are really heavy periods, periods that last a long time, so like 8 to 10 days, and they're bleeding through really, really, those heavy pads, or like they just seem to bleed through everything, and they're losing a ton of blood, and that just was not my case. My periods had been completely normal, only lasting, maybe 3 to 5 days, maybe, so and they were not that heavy. I mean, I might have had one. And to this day, like I'll have one day where it's really heavy, and after that, it's like kind of tapers off. So I was asymptomatic in that department, and but what led to finding out about the fibroids is I went to the emergency room in November, and um, my family and I, me and my husband, and then my sister and her husband, we all went to Disney in Orlando because my sister lives in Tampa, and we spent the whole day walking around, which it was a nice day. It was in November, so it wasn't very hot, and it was a great day to me for getting lots of cardio in, and a good amount of exercise. I've been exercising since I was a kid. So exercise is not something lost on me. It's not brand new on me. I enjoy weightlifting. And so anyway, went to the emergency room because I was having trouble urinating. And um, I had actually been having trouble for quite some time. And once, like several months prior, I was, so last July, I think I was getting on a plane, and I was having trouble emptying my bladder, and I could still feel that it was full, but I couldn't push the pee out. There was like nothing I could do to get the pee out, and I knew that there was still pee in my bladder. So it wasn't like I was crazy, or there was nothing. It wasn't psychological, is what I'm trying to say. It wasn't psychological. This was totally real. Like I was feeling that I could not empty my bladder, which is, after a while, it starts to send those, like, you kind of internally panic a little bit. I don't know if that's ever happened to you, but I panicked a little bit, for not being able to empty my bladder. Um, and so anyway, going back up to November, um, I went to the emergency room. So we went to Disney that Saturday, and then Sunday came, and then Monday, I believe, it was something like that. It was like the day after, or either 24 to 48 hours later, I was in the emergency room and I couldn't urinate. And so um, they had to do a Foley catheter, and which is like a temporary catheter, that they put in. You put it in for some amount of days that you basically wear around. It's like a leg catheter, and they emptied my bladder, and they said that typically when the average person urinates, they release about 200 to 250, I think, milliliters of urine, and I was storing up like 1,000, like 1,100. So that was almost a whole day's worth, I guess, of urine that I was holding on to, and my belly was extremely distended. It was really like, really like looking bloated, basically, and it was very tender. I felt like a balloon that was going to pop at any second. Um, And so they released me. I was able to see a urologist down in the Tampa area very quickly. And then, I was recommended to see someone when I come home to Georgia. So it happened again in December. We were supposed to all go out for my sister's birthday up here. I have a sister in Tampa and I have a sister here in Georgia. And we were supposed to go out for her birthday, but on her birthday, I ended up in the emergency room once again. So, um, same issue, same problem. Um, and they had to send me home with a catheter again. And so, both of those times I went home with a catheter. Both of those times I had to keep that catheter in until I could see someone. Um, and so I was having to um, actually go empty the catheter into the toilet and all of it. These were the symptoms I was experiencing because of fibroids. I wasn't having heavy periods or anything like that. I was having urinary issues because the the fibroids were growing on my uterus, which is sitting on top of my bladder. Um, and so yeah, so that's how I basically got to this point. And in the middle of all of this, right, my husband and I, we've been married for 4 years. Um, this as of right now, we've been married 4 years, and so we started to try to conceive 3 years ago. Like after year one, we were ready to try to conceive, but we've been having difficulties this whole time and really couldn't understand what was going on. And all this is kind of taking place simultaneously, right? So um, I'm seeing my GYN talking about different methods to like try to figure out what's going on with the fertility. She sends me for imaging and all the things that she can do as a regular GYN. And so then she says, I've done, or she was out one day and another GYN said it. I've done everything I can do for you. I think it's time, we think it's time for you to go see a specialist. And so I was like, okay, so fine. Well, I'm ready to see, this person. So we went to REI, which is reproductive endocrinology and infertility, or it's basically the fertility clinic. So that's part of our hospital. And so they were doing everything that they could, getting all the questions answered. And, she had started me on some vitamins to help with the egg quality, my egg quality and all that good stuff. They were trying to do everything they could. And they went in to do this one imaging, of my uterus, and she could not move beyond whatever was blocking the way for her to reach as far into my canal as she could. And and that was, I will say, that was a horrible and terrible experience. I absolutely had a terrible experience with that doctor. As nice as she claimed to be at first, she made me feel terrible about it. I was really embarrassed at how everything went down with her. Um, so make sure that you truly feel comfortable with your doctors, ladies. But so yeah, I basically found out that my fibroids were the cause of my infertility issues. My husband's count and like his quality, his sperm quality was just fine. And we're talking like this only happened a couple months ago, like not even 6 months ago. This was like 3 or 4 months ago we found all this out. So his sperm quality is fine. My egg quality, my egg count is fine. It's these fibroids. And I thought, oh my God, it's also the fibroids because of the urinary issue. So all this like urinary problem and also fertility problem is just like this, it's the fibroids. So I got sent to the GYN, the oncology GYN oncologist. I went to go see the GYN doctor who deals with cancer patients typically, but these doctors also deal with women who have fibroids. Um, and so I got the shock of my life that I have to have surgery basically immediately, and that the surgery, it cannot be laparoscopic. And laparoscopic is where they just make the little tiny incisions. they go in with like a robot with a robotic arm or whatever, and because the incisions are so much smaller and they're using a robotic arm, your healing time is a lot quicker. But my fibroids are so large that he actually doesn't feel like that's the best option for me. He's going to need as much room as possible to remove my fibroids. So he's going to go in, he's going to do the C-section cut, but he also has to do a vertical cut. So from belly button going downwards, and then the bikini cut across this way. So, so yeah, that's the news. It's gonna happen in about a month. I am excited and nervous all at the same time. Like I said, I've had surgery before, so I know how this goes. But I am nervous about having to wake up and find out that I may not have a uterus. So I hope I don't scare anybody. I think my case is unique because I'm type 1 diabetic, so that complicates things more than it does for women who are not diabetic and don't have any other major health issues or disabilities. But um, the only reason he would remove my uterus is if I have too much blood loss. So I think that's pretty standard. I've asked 1,000,001 women about, their experiences. I've looked out, well, I say 1,000,001, as many that I could find as I could, um, who've had this surgery. I asked them about their experience. Um, and so I did find out that it is common to hear that the doctor will tell you that they will leave your ovaries in so that you have that regular hormone production, and you don't basically go into menopause. But the only reason he would remove my uterus is if I started to lose too much blood. So that's still scary because I have a lot of fibroids and I'm scared I could wake up without my uterus. Um, but that may not be the case for everyone that will have a myomectomy. But for me, my case is severe enough that he had to communicate that to me, as well as telling me that he was going to do a C-section cut as well as a vertical cut straight down. So I think that was all I wanted to tell you guys. I'll show you my belly. I am very self-conscious about this. I've always been extremely self-conscious about my weight. Sometimes, so I don't know if you guys don't know. You probably don't even, anyway. So I am not only my black, but I'm Filipino, and I was raised on my Asian side of the family, and this is my grandmother who has since gone on to be with the Lord, but this is my grandmother. She was a lovely, spicy woman who loved to cook and laugh and loved all of us grandkids. But anyway, so in Asian cultures, in many Asian cultures, there's this press to be fit and slim, and they will poke and prod at you if you are on the heavier or chunkier side. And I was always kind of chunky, not this heavy though, my God. So, but also being a black woman, I know that the likelihood that I was going to end up with fibroids, now I understand that it was much higher than, my non-black peers. So, but anyway, so this is, hopefully I can show you guys. This is where I'm at right now. I look very pregnant. Like, I know I do. And I know that, some of this may be due in part to just having naturally gained weight, but this has been really hard for me to feel like this, and knowing that there's not a lot that I can do. 2 months ago, 3 months ago, I was 180, and then it kind of crept up to 190, and now it has crept up to 200 pounds. And I can't really say what the cause of that is except this freaking fibroid. And so I'm going to show you guys. So I have shorts on under here, but this is my belly. And as you can see, it protrudes quite a bit. And usually around the time that my period comes, I start to feel like I'm carrying a bowling ball like right here, and it's so heavy. Oh my God, is it so heavy? And the day that I met the oncology doctor, I was actually like, I was like really, really bloated and like really, really distended, right? And I was like, I had to like waddle. And this still happens. Like sometimes I feel like I have to kind of waddle in or waddle out of wherever I'm walking to because my belly is so heavy and so full. And it's not food, it's not water or anything like that. This is just fibroids. And the difficulty of trying to lose weight when you're carrying this around, it's impossible. Um, it feels impossible when you feel like you're carrying around a bowling ball underneath your belly button this whole time. And so, yeah, I'm having surgery. Um, and I'm nervous about it because not only do I still want to have kids and am I worried about waking up with my uterus, but I'm type 1 and I'm concerned about how my body is going to have to deal with the the healing process. Um, anytime my body is under stress like that, um, I my glucose gets really high, and I haven't been able to work out successfully for a number of reasons. I'm a migraine sufferer, and I live in the South in and it's summertime, so that's miserable. I'm currently at in a sort of voluntary position. I'm in rotations as an occupational therapy student. And so, where I'm at right now, doing my clinical rotation, I'm sitting at a desk for 8 hours a day, basically in this position. And sitting at a desk job all day is terrible for your posture. It causes a lot of neck and shoulder and back pain. And I already had neck and shoulder pain from having um, frozen shoulder on both sides. I had surgery on these in 2019 and 2020. No, 2020, yes, 2019, 2020, something like that. But it was already, I was already in a lot of pain. And so jumbling all of these confusing and difficult factors together makes it so hard to get a good workout. So I'm having to rely on waiting for it to be cool at night and hoping that my belly doesn't feel too heavy, and having to turn down events where there's going to be a lot of walking involved, or a lot of movement if my belly feels really heavy. um, Feeling tired and fatigued from this is ridiculous. So for those reasons, I cannot wait to have the surgery, you guys. But for some of the other reasons, I'm nervous, but we'll see. So, yeah, yeah. So I'm having an open myomectomy in August, and I guess I'll keep you guys updated.